Bismillahirrahmanirrahim. Assalamu alaikum. Welcome into my YouTube channel Insight. We are discussing the unseen flaws in our healthcare system. Today is the second episode of our vlog series on this topic. Imagine walking into a hospital, trusting that every test, every surgery, and every medication prescribed is backed by solid evidence. But what if I told you that a significant part of modern medicine is built on outdated practices, hidden risks, and financial incentives that don't always align with patient care? Did you know that medical errors are one of the leading causes of death worldwide? Yes, many of these errors are preventable, if only we know where to look. As a doctor, I have always believed in evidence-based medicine. But after reading Blind Spot by Dr. Marty, Makary, I realized how much happens behind the scenes that both doctors and patients need to know. Welcome to this vlog where I break down the key insights from Blind Spot, a book that reveals the hidden flaws in our healthcare system and how we can fix them. Dr. Marty Makary discusses topics such as the rise in peanut allergies following guidelines that advised delaying peanut exposure in children in US, the opioid crisis stemming from misconceptions about addiction risks, and the overprescription of antibiotics contributed to drug-resistant bacteria. Let's have a brief overview of the 12 chapters of the book Blind Spots. Marty Makary's book Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. The insight of the book: to understand the global rise of unnecessary healthcare and what we can do about it. This is part 2 of our discussion, where I shall present to you the summary of the chapters of the book. But before sharing with you the summary, few words about Dr. Marty Makary. He practices surgical oncology and gastrointestinal laparoscopic surgery at the Johns Hopkins Hospital. He writes for the Wall Street Journal and served in leadership at the World Health Organization. He is a New York Times best-selling author. He received the 2020 Business Book of the Year Award for his book, The Price We Pay. His newest book, published in September 2024, Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health, has caused an earthquake in the American medical world by putting in black and white certain facts which are normally kept away from public gaze. No wonder his book is selling like the proverbial hotcakes. This book comprises 12 chapters, and each chapter is addressing specific instances where medical practices have led to unintended consequences. So, this summary is based on when I read this book and what the message of each chapter is. I'll share with you the summary and message of that chapter. The chapter 1, entitled The Salem Peanut Trial: How Experts Created an Epidemic. This chapter explores the surge in peanut allergies in the United States. In 2000, the American Academy of Pediatrics recommended delaying peanut introduction in infants, aiming to reduce allergy risks. However, this guideline, based on limited evidence, led to an increase in peanut allergies in United States. Dr. Makary discusses how fear-driven policies rather than scientific evidence can inadvertently create health epidemics. In the second chapter of the book, entitled, "Oh my God, HRT? The Untold Story of Hormone Replacement Therapy," Dr. Makary examines the controversy surrounding hormone replacement therapy in this chapter. Initially prescribed to alleviate menopausal symptoms and believed to offer various health benefits, HRT faced scrutiny after a 2002 NIH study linked to increased breast cancer risk. Makary reveals that the study misrepresented its data, leading to widespread fear and discontinuation of the therapy, despite subsequent research not supporting a significant increase in breast cancer risk from HRT. This chapter highlights how flawed studies and media hype can lead to persistent misinformation. In the third chapter of the book, the title is "No Downsides to Antibiotics Except Carpet Bombing the Microbiome." We know while antibiotics have saved countless lives, their overuse has significant downsides. Antibiotics not only kill harmful bacteria, but also decimate the microbiome, which plays a crucial role in digestion, immunity, and overall health of we human beings. Makary discusses the mounting evidence linking antibiotic overuse to chronic diseases, including obesity, allergies, and inflammatory bowel disease. He also explores how the medical system's overprescription of antibiotics, driven by the misconception that there are no downsides, is creating antibiotic resistant superbugs and harming patients' long-term health. The fourth chapter, entitled My Uncle Sam Loves X, The Truth About Cholesterol. This chapter challenges the long-standing belief that dietary cholesterol, especially from foods like eggs, causes heart disease. Makary recounts the story of his uncle, who was advised to avoid eggs due to high cholesterol. Years later, research revealed that dietary cholesterol has little effect on blood cholesterol levels. Makary explains how flawed science and misleading public health advice led millions to unnecessarily restrict cholesterol-rich foods, overlooking the nutritional benefits of items like eggs. The fifth chapter of the book, entitled True Believers: Why We Resist New Ideas. This chapter delves into the psychological phenomenon of cognitive dissonance, where individuals cling to established beliefs despite contradictory evidence. Makary explores how entrenched medical dogmas can lead to resistance against new, potentially life-saving treatments, emphasizing the need for openness to innovative ideas within the medical community. The sixth chapter of the book, with title of Bad Blood: How the Medical Establishment Works. In this chapter, Makary highlights the failures and bureaucracy of the medical establishment, particularly focusing on the HIV epidemic in 1980s. He recalls how blood transfusions were a significant transmission vector for HIV and hepatitis due to slow reactions from health authorities. Through the story of Dr. Don Rucker, Makary exposes how the medical system's institutional rigidity can lead to catastrophic outcomes, especially in crisis, arguing for more accountability and transparency within the medical institutions. The seventh chapter of the book, with title A Warm Welcome: Rethinking How We Bring Babies into the World. This chapter critiques the medicalization of childbirth, tracing the shift from traditional, less invasive birth practices to the highly controlled hospital environment that became the norm in the 20th century. Makary explains how procedures such as immediate umbilical cord cutting and separating newborns from their mothers became standard, despite evidence suggesting these practices were not always in the best interest of the mother or child. The chapter advocates for a more balanced approach that incorporates the benefits of modern medicine while also respecting natural childbirth practices. The eighth chapter of the book, entitled Challenging Certainty: The True Origin of Ovarian Cancer. This chapter focuses on the evolving understanding of ovarian cancer, challenging the previously accepted notion that it originates into the ovaries. Makary explains how new research has shown that ovarian cancer often begins in the fallopian tubes, which has implications for early detection and prevention. The chapter serves as a reminder of the dangers of clinging to outdated medical dogmas and highlights the importance of staying open to new discoveries. The ninth chapter of the book, Silicon Valley, breast implants, autoimmune diseases, and the opioid crisis. Makary tells the story of the controversy surrounding silicone breast implants and the broader implications it had for medical litigations and the opioid crisis. The chapter recounts how a media frenzy, fueled by a 1990 report, led to the widespread fear about the safety of implants. This fear was largely unsupported by scientific evidence, but it sparked mass litigation and distracted from other important health issues. The 10th chapter of the book, A Comedy of Errors, a short history of medical groundthink. This chapter provides a historical perspective on how groupthink within the medical community has shaped medical decisions, often to the detriment of patients. Makary illustrates how medical professionals can become entrenched in certain ways of thinking, leading to widespread acceptance of ineffective or harmful treatments. The chapter emphasizes the importance of fostering a culture of skepticism and critical thinking within the medical community to avoid repeating past mistakes. The second last chapter, chapter 11, entitled A Culture of Obedience, the Battle for Civil Discourse. In this chapter, Makary discusses the importance of civil discourse in the medical field, particularly the need for medical professionals to feel empowered to question authority and conventional wisdom. And in the last chapter, entitled Imagine, What Else Are We Getting Wrong? In this chapter, Dr. Marty Makary encourages a critical examination of current medical practices, urging both healthcare professionals and the public to remain vigilant and open to re-evaluating established norms. He highlights several areas where prevailing medical beliefs may be based on insufficient evidence or flawed assumption. So, dear viewers, in this second vlog, I wanted to share with you the summary and main messages of these 12 chapters of the book, which I understood and which I got after reading it. In the next vlog, that is the part 3, I will share with you some unnoticed facts from the healthcare system in the United States, which Dr. Makary has revealed. What are those 25 revelations? I'll share with you that. And after that, we shall evaluate our own healthcare system, that is in developing countries like Pakistan, that how we compare our healthcare system with that of the United States, one of the most developed countries in the world. And in the last setting, we shall see how to apply the findings of this Dr. Makary's book into our own healthcare system. So be with me. Tomorrow I shall share with you the unnoticed facts from the healthcare system of United States as revealed by Dr. Makary. Till then, take care. Khuda Hafiz.